Just be authentic to yourself, to your vision, your dream, to your health. Make time for your self-care, and that's how you thrive. There's a group of women all over our medical community who are just rooting for you and your wellness. We really have to heal from the inside out, and I think that's my pearl is treasure your health, treasure your wellness, and it will just be contagious at the end of the day.
You are listening to the Pinnacle Podcast, where we empower women in medicine through education, community, and actionable strategies for both the practice and the business of medicine.
Medicine is a lifelong career, and continuing education is crucial for professional development. Pinnacle is the first and only multi-specialty organization dedicated to addressing the challenges that all women in healthcare face.
Welcome to Pinnacle, the elite professional community providing education for women in medicine. At Pinnacle, we challenge you to pave your own path by helping you develop the skills needed to not only stay in medicine, but to excel. Welcome to the Pinnacle Prescription Podcast. I'm your host, Dr. Rupa Wong, and today I'm joined by Dr. Melissa Mondala for Food as Medicine, what we didn't learn in medical school and how it can help your patients and your own health. Dr. Mondala is a double board certified physician in family medicine and lifestyle medicine. She has held numerous leadership positions at the American College of Lifestyle Medicine, including board of directors and president of ACLM trainees. She's also the president of Dr. Lifestyle Clinic in Newport Beach. She has a true passion for educating and empowering healthy living and cooking on Instagram and YouTube. So I can't wait to get started in this discussion with her about this really neglected topic in healthcare. Melissa, thank you so much for joining us today.
Thank you so much, Rupa. I'm so glad to be here and speak on this. And of course, it's always great seeing you and all the work you're doing. I'm so proud of all your collaborations and all the things you're doing in the Pinnacle world.
Thank you so much. It's so sweet of you. You are impressive. You have a very impressive combination of specializations with family medicine, lifestyle medicine, and even integrative psychiatry. What inspired you to pursue these fields together, and how do they complement each other in your practice?
Yeah, great question. Thank you. And I would say it started very early. In undergrad, I did love psychology. I loved health psychology, specifically doing research in the doctor-patient relationship. And I knew that human behavior was really important. It was important for compliance and trust. And to me, I felt that family medicine incorporated all, not just all ages, but all types of diagnoses. You're the gatekeepers. And then quickly I went to my residency in Loma Linda, which is one of the blue zones, and that's where they live. Not only till centennials, if you've ever watched some of their documentaries of Forks Over Knives, What the Health, those are the key places where the Adventist studies took place, not just in Loma Linda City, but all over California in that population. And I saw people who were thriving on minimal medications. And I saw that outside of the clinic, but unfortunately inside the clinic, I saw a lot of sick people who were either need more medications. They didn't really have solutions. They had chronic diagnoses, and it was almost like a revolving door. You kept seeing the same people in the ER and the urgent care, and they weren't necessarily getting better and not addressing the root cause. So that's why I went into lifestyle medicine. I was introduced in that in Loma Linda about 2016, quite a while ago, and that's when I went into the research, dived in, went into ACLM, and it was really it stood for itself. I knew that about 80% of people have some type of chronic diseases that is linked to their nutrition, their exercise, their sleep, their stress. So after that, I knew that this is something I can actually apply to all diseases, all chronic diseases. And later on, going in through, I would say, residency and my private practice, I knew still we didn't really address anxiety, depression very well. I felt that there was a lot of gaps in that space because not only are primary care doctors one of the first to diagnose, but they often are just given basic I would say, antidepressants and anti-anxiety medications, which are really important, but the counseling was often delayed, and lifestyle is usually the first line treatment for most of these diseases. So I went into primary care psychiatry and integrative psychiatry. These are both certificates, fellowship likes, I would say 1 year on, I would say the concepts that we see, but more into not just lifestyle, but supplements, mind body medicine, and seeing which ones are safe and which ones are actually therapeutic. So that my goal was, because there's so much out there that people can get confused on. I really wanted to see the evidence and know what really works.
Oh, thank you for explaining that. And you, I think are so, I mean, you're absolutely right. We don't sometimes look at the root causes. And I think now there is this push to really look at the patient holistically. And I know I've seen this when I'm on the flip side as a patient, but lifestyle medicine, that's a relatively new specialty. Could you just talk a little bit about that, what you needed to do to get that board certification and what it involves?
Yeah, great question. So with lifestyle medicine, it's what's nice is ACLM's been around since 2004. The research has been for much longer, and the certification. Usually, you just have to take, I would say, go to a conference, and I think there's 100 CME units or so, and then you go in and take the board. For me, I was a little bit different. I did a fellowship at Loma Linda, and I think that was just really rewarding because we were able to see it in the inpatient side and the outpatient. We worked in PM&R, so we were able to see an acute rehab, post-stroke, post-MI, transplant patients, and see how we can implement lifestyle factors and see when they're nearly on their deathbed, how can this be applicable? How can we start actually getting their life back? So that was rewarding. And then I did some intensive lifestyle change programs, which were like 15 to 30-day programs that you can actually implement these, I would say, protocols and see the changes and how to safely modify and reduce meds when safe and when the labs are actually showing significance. So I think that was really rewarding. But really, there's now, I would say, about 2 to 3 thousand lifestyle medicine practitioners, I
Wow.
believe globally now.
Wow.
So it's really amazing how ACLM has grown.
And I love that it's evidence based, right? I mean, there's a lot of stuff that's out there on social media, online that's not evidence based, and of course, this body makes sure that there's scientific data behind everything. And I know, in general, I mean, a lot of this is kind of, I would say, difficult for many of us in medicine to practice, right? We weren't, I graduated med school in 2002. I mean, this was certainly not even on the radar for us to incorporate for ourselves or even for our patients. I think even just specifically nutrition, right, isn't covered that well in medical school or residency. They'll just say low fat diet, or we'll be rounding and they'll say a low salt diet. And I know when I had gestational diabetes, or even now as I battle with my kidney issues, there's the physicians are often really don't have a lot of knowledge to explain what I should be doing nutritionally, and it's not covered. So could you talk about some of the essential aspects of nutrition and lifestyle management that you felt were missing during your training and how you recognize their importance?
Yeah, great question. I would say this brings me back to my medical school, and even before that, I knew as a patient, I was someone with IBS, GERD, and someone who had, the bowel, bloating, diarrhea, and then poor, really bad acne. So that's also a layer of what got me into lifestyle medicine, because I knew that I went through all the rounds of antibiotics and all the medications, and there was really no solid answer, and my quality of life wasn't so good. And so that's why I really knew if I was going to try something, I wanted to first try it on myself, yeah, see how I can heal, and then try it with my patients. So, and I really think nutrition is really a mixed bag. Even dietetics all around, RDs around the US and around the world, they have conflicting views. And because of the research, like if you look at the research in France versus US, and how they portray fiber versus protein. It's conflicting.
Oh,
So there's really hasn't been a consensus, and not necessarily the research. It's more of the what the focus, how it was designed, but more so they are still focused on like standard American diet, or standard ways of eating. They are more on high protein internationally, and I'm glad the U.S. is now having more higher fiber. In the USDA and the Canadian diet recommendations, there's more now fiber recommendations, whole food recommendations, less saturated fat. So it's nice to know that not only is like cow's milk the drink of choice, now water is a drink of choice in Canada, for the USDA guidelines. And so this has been decades, hundreds of just work of behind the scenes in the academics industry, but also it's also in the industry itself. The food industry has been very influential. So it can be very confusing for those who are trying to tease out the science, and see what is truly evidence based and truly therapeutic. So in the lifestyle medicine, I would say ACLM, but also in the research, we really try to see, okay, what are these studies showing? What did they really, what kind of foods, what 2 grams of what, and 30 grams of this. So, and really the fiber is key. So I would say, yes, 30 grams of fiber per day is ideal. But we don't learn that in medical school. And if we did, it was no one really understand where does fiber come from.
Okay, I didn't want to sound stupid, but I did want to stop you there because I am the person who entered medical school thinking that a chocolate bar had no fat.
Yeah, I was
I mean, I
right.
weighed like less than 100 pounds. I never had to diet, and I just didn't think about the nutritional aspect of food. Okay, so can you break it down for someone who doesn't know a lot, like myself? 30 grams of fiber. What does that mean? Like, what is it? 6 oranges? What is it? 7 apples? Is it fiber supplements? What does it mean?
Yeah, great question. And that's so important because sometimes we go in and we get the fiber gummy and we think we're done. But
Yeah,
literally, it is so you can start with a bowl of either rolled oats,
I
still cut
I do that.
oats. Yeah, yes, great. And then, so one big bowl, and then I would say 2 servings of any like a blueberry or a raspberry or a strawberry. And then you can put 2 tablespoons of flax seeds, 2 tablespoons of chia seeds. These are all great because not only high in fiber, high in omega-3, and also they are the derivatives, I would say the precursors of tryptophan and tyrosine. And so those are the building blocks for serotonin, dopamine, norepinephrine. So those are your neurotransmitters. So that's like the brain heart health breakfast.
Okay. I
That's
like it.
really
You gave me exactly now yes, perfect. I know what to do now for breakfast. Or chia seed pudding, is that a good one? That's something we make a
yeah,
lot in our
chia
house.
seeds with pumpkin seeds. I love pumpkin seeds. Um, so and it's an extra crunch too.
Yes. Okay, I got it. So breakfast there. Lunch, what would you recommend?
Yeah, for lunch. Oh my goodness, I love lunch because you can get really creative. I love either Buddha bowls. I know you're on the islands and
Yes.
or like a Mediterranean bowl, so it's pretty simple. Some people load up on rice, but I really love to see more of just whole grain, either brown rice or just like a salad, like a mixed salad base. That would be really wonderful with some air fried or just fresh tofu, and then you can do a crispy chickpea or fresh chickpeas from like a can that you rinse out twice, because of the BPA. And then you just can cut up your favorite veggies, if it's cucumber, if it's some cherry tomatoes, or if you like, some people like the fermented foods, like you can add a little bit of kimchi, watch out for the salt, or
Uh,
like a beets, um, slices of beets, and then I do like corn's really great, and black beans for high protein. That's what I usually do, and so that's really complete. I like to say at least a 5 to a 10 ingredient mix Buddha bowl or a
oh,
salad.
that's great.
So
Okay, so we
that's
got lunch covered because I don't know if you're like this or if people who are listening are like this. I will eat the same thing over and over. If I like it, it's delicious, then I don't have to think, right? It's one less decision I need to make. So there, you've made my lunch for me. Now, what about dinner?
Yeah, exactly. And dinner can be really simple and light. I like to have like a nice base if it's a miso soup, just like with bok choy or tofu. Some people like something else like grilled veggies with like sweet potato with their favorite, I would say you can do tahini miso dressing on top. Broccolini is really great. I do more of the like roasted tofu or bowl of beans. It depends what like ethnicity you like. I get this is like my favorite topic, so I can literally go down
I
the
love
list
it.
on what kind of cuisine you prefer, and I have tons of recipes.
I love it. And then you're obviously you're plant-based, correct?
Correct.
So are you, how do you make sure when you're on a plant-based diet? I know this is probably a question you get all the time about the protein. I'm perimenopausal, 48 years old, hearing the importance of protein in this age. Now, I think different in a younger age, but for women of our age, how do we get enough protein on a plant-based diet to ensure we don't lose a
Yeah,
lot of muscle mass?
exactly. Thank you so much for that question because often people hear advice and they don't really know that there's certain age groups that need different, um, I would say, requirements. And for example, from a pediatric age, even all the way to teens, someone who's developing needs different omega-3, DHE, all that different requirements in proteins. But each decade of life has different protein requirements, especially the perimenopausal and geriatrics. So the protein requirement does go up. So, uh, so that's and so I think it's just a there's a really good book, by the way. It's called I think it's Plant Powered Protein. It's by a registered dietitian by Brenda Davis, and she breaks it down with really great recipes. And I would say to ensure it, I would say every meal, do your best to have some type of protein. If it's in the form of tofu, tempeh, edamame is really good. You can also do, I love like lentils and beans. Sometimes I just put some protein powder and make a power smoothie, a high protein, high fiber smoothie for the day, because you definitely want to supply your that change, and especially a lot of perimenopausal have like brain fog, that's changing and
Yeah.
and I've seen it, and I totally, and I've experienced in some level, because even post COVID people are getting in this
Hmm.
realm um, of brain fog,
Yes.
and so we need to supply the brain full of the neurotransmitters, the essential amino acids, and the omega 3s. So it's really important. And of course, menopausal need their bones. So one of the lifestyle medicine pillars is exercise. So really resistance training is going to be your best bet. 150 minutes per week of moderate exercise and mixing some cardio and I would say some resistance training. I joined F45. I'm not like promoting them at all, but it really changed the way I do things because I'm able to see my strength build over time, and that we tend to just be really comfortable in our exercise routine and not
Yes.
necessarily challenge ourselves.
I know, shake it up a little bit, right? I mean, and that's the thing, because we can get in a rut ourselves, our patients can too. Like, what have you found specifically with your patients? Do they have common misconceptions about lifestyle and nutrition, and how do you address them? Is it the exercise portion? They're just doing a ton of cardio? Is it they can't be plant-based and get enough protein? What do you find?
Yeah, a lot of people are still stuck on the kind of like the dairy component. Some people, it's hard for them to kind of give up dairy because they grew on up on the ice cream, the cereal. It's everywhere in the pastries. And I'm really grateful now that not only are there great recipes, but great restaurants and businesses that are able to have more dairy-free alternatives. The research does show that about 80% are lactose and whey
Mhm.
sensitive. And so, and in the I would say African and Asian population, it goes up to 90%. So there is a big sensitivity there. So a lot of people they don't realize that's why they have bloating or
Mhm.
eczema or acne or some baseline, I would say rhinosinusitis. Those are big contributions to their allergies. So that's kind of the first step I ask is just try to find dairy-free alternatives and see. And of course, every patient is different. Some people may be worried about soy and scared about soy. And so that I address that really spot on because there's a lot of conflicting, I would say, information out there. Have
Very
you heard of
much.
that, Rupa?
Oh, I have. I'm not plant-based. I've tried it in the past. It was harder than, and we don't,
It's
I
hard.
grew up vegetarian, so it wasn't that, it was just the cooking for a family and making them all be plant-based while I did it, which is the way that we do it. So we kind of eased out to being pescatarian, but we have plant-based members of our family. And that was one of, I have to say, I fell for some of the misinformation about soy and the hormones, and my family were like, that's not real. You should know that.
I know it's so confusing out there, right? And then I would say like even Mediterranean and pescatarian is like the best start you can have because it's better than like a standardized American diet. So I say I really encourage people to and I would say reinforce like you're doing the right thing if you're doing Mediterranean and pescatarian because there's still a lot of research that helps. Um, and if you want to take it to another level, is that's when I talk about like the dairy-free alternatives and soy being really safe. It's been studied in big cohort studies. Even Japanese culture, they've been having soy for centuries,
Yes.
and they don't have higher rates of
No,
breast cancer
no.
at all. So it's really nice to see that um, really the whole foods is what's the etymology is the safest. What makes it a little mixed is when you have manufacturing, processing, and adding emulsifiers
Mm-mm.
such as guar gum and all these other alternatives that cause increased intestinal permeability or leaky gut. So then their gut's not happy, which is the gut brain immune connection. Then everything else just gets wow
Yeah.
pretty angry and upset. But really, the first thing is dairy free, more plant based eating, less processed food,
Mm.
and really just focusing on movement. It's really movement is underrated, especially in busy America.
And even just, right, the power of walking. That's what I've been doing. I sprained my ankle, so I can't run anymore. So I've just been going for a morning walk every day, and so many benefits of that. I know you've talked about that as well.
Yeah, so walking is amazing. I like to do it after meals. That's really good because you get to keep the sugars low so you don't have a big insulin spike. So after meals or early morning or when the sun goes down is really nice. And then I joined Reformer Pilates, so I'm just always trying to
Oh,
change something new. That's what I encourage my patients. Just don't get bored. Just keep trying, keep moving.
I love it. And what challenges when you're talking to your patients about all of these modifications, the lifestyle and the dietary changes, what challenges do you face with them in instituting this into their daily habits? And then how do you help them overcome that?
Yeah, great question. The most important thing is they, I hear them out, I listen because sometimes, yes, truly they lack time. Their schedules don't allow it. They are busy, um, moms, entrepreneurs, or just they haven't been able to prioritize their lifestyle. Two, they maybe not know how to cook certain meals. And then three, they barely feel unmotivated because they've probably been trying this most of their life. People who are especially overweight and obese, they've probably heard a million times that they need to lose weight,
Yeah.
and it's just a matter of finding out what motivates them. What's their big why, and taking really, really small steps to make it realistic and relevant for them. It's not going to be my plan, it's going to be their plan. It's really going to be something that they can wrap their mind around with, something that they believe in, because that's where you want them to understand, because they need the buy-in, they need to buy in into what they're trying so that they can be a little bit more lenient and compassionate with themselves,
Mm.
because it is a mental battle. That's like the biggest battle.
Absolutely. And I love that you say just those small steps and really figuring out why they're doing it, that can hopefully then keep them with the plan moving forward even when it gets hard, because that's the hardest part, because it's just sometimes it's just easier to grab something that's processed, right? Or a package of even like a vegan burrito. It's still not the best thing. Better if you can make it from scratch, I would imagine.
Yeah, and there's always alternatives. You're gonna have your good days and maybe not the best days, but you
Yeah,
always have alternatives. You always have a fridge and a pantry with better options,
that's
and
very
that and
true.
you can have fun.
I love that. How do you see the role of food and lifestyle medicine evolving in general healthcare? Are there specific changes that you want to see in the next couple of years? Do you see it going, your board going in a direction that you're excited about?
Yeah, exactly. So, um, the biggest research has been on cardiovascular,
Mhm.
type 2 diabetes,
Yes.
and I would say now we're looking into, Alzheimer's. We're looking into certain types of cancers. Dr. You and I, my husband, we have our Dr. Lifestyle practice, but also Remission. And at Remission, it's a telemedicine practice with RD psychologists, lifestyle medicine providers, and we are embarking into new research for autoimmune disease. We've already seen really great results, up to 50 to 60% go into remission or reduction of symptoms, and 95% of our patients reduce their symptoms within the matter of a month or two. So we're just really
That's
grateful, and
amazing.
we want to be able to publish some research. So I really think ACLM lifestyle medicine will be more specialty based and disease based. So we want to be very prescriptive and how we actually recommend these therapeutic interventions.
Interesting. Oh, that's really, really fascinating to think about it being specialty based versus disease based. Okay, we're coming close to the end of our time together. So, what is your one pinnacle pearl to share with other women in medicine?
Yeah, I love it. Thank you. I would say first thing is just be authentic to yourself, to your vision, your dream, to your health. Make time for your self-care, and that's how you thrive. And really, there's a group of women all over, I would say, our medical community who are just rooting for you and your wellness. So make time for that. It's just something that we all love behind the scenes to really bring our best, but we also have to be our best internally when no one's looking, because we really have to heal from the inside out. And I think that's my pearl is treasure your health, treasure your wellness, and it will just be contagious at the end of the day.
That's such a good one. I love that. I love that. All right. Can you tell everybody where to find you, either online or in person?
Sure, yes. Thank you so much. So I'm all over social media on Instagram, Dr. Melissa's Kitchen. So you spell out my name and you'll see a bunch of recipes and tips. I'm at Dr. Lifestyle, is my private practice, and I'm the lifestyle medicine director at Remission. So you can see us in either of those states or insurance or cash base. I'm just happy to be part of this movement because there's just so much to, I would say, do, and also a big world to serve. So thanks for your time, everyone.
I love it. Thank you so much, Melissa, for joining us today. I learned a lot. I can't wait to go check out. I mean, I follow you already on all the social media channels, but now I'm really going to make sure I get these recipes because it's time to just start building great habits for the whole family. So I'm excited to check everything out. Thank you again for taking the time today.
Of course, my pleasure. Have a great day.
You too.
Thank you for listening to the Pinnacle Podcast, where we strive to elevate the voices of women in medicine and inspire excellence across the healthcare landscape. Until next time, keep reaching for your pinnacle.